I'm Dylan Nolan here for FITSNews at the South Carolina State House, where just a couple minutes ago there was a ceremonial signing of the repeal of the Certificate of Need law. I'm here with the author of that repeal, State Senator Wes Clymer. Can you explain to somebody who maybe isn't familiar with Certificate of Need, often shortened down to CON, why it's a bad thing and why you authored a repeal?
Sure. So, Certificate of Need is a government-required permission slip for investment in a healthcare facility or healthcare equipment. And so for the last 3 decades or so, if somebody in South Carolina wanted to build a new hospital, build a new surgery center, buy an MRI machine, anything like that, they first had to get a permission slip from the government before they were allowed to invest their capital to serve their patients. And so by repealing Certificate of Need, we allow the private sector to invest, to grow. It creates more competition among healthcare providers, and as a consequence of increased competition, what's going to happen for patients? Lower costs, more choices.
Yeah, and South Carolina is a state with a lot of folks living in rural areas where it might not be the most profitable for these healthcare companies that already have a monopoly to put a new location, but they could use CON to keep people who might want to try to go into business from opening something up. So this was definitely not good for people living in rural areas, poorer people. So seeing this go away, we're going to have more beds, we're going to have more access to healthcare.
That's exactly right, and not only more hospital beds, but really I think we'll see a significant increase in the number of outpatient surgery centers across the state, which have proven to be typically much higher quality of care and much lower cost concurrently. And so when you think about having more high quality care at lower prices, patients ultimately win as a result of repealing Certificate of Need.
Thank you, Senator Clymer.
Yeah. Thank you, Dylan. Good to be with you.
Senator Clymer laid out the legislative aspect of CON. I want to show you a clip from one of the physicians who spoke at the bill signing. Dr. Patel is an oncologist in Rock Hill, South Carolina, who gave a great perspective on what this repeal means for healthcare providers.
I'm Dr. Patel, oncologist from Rock Hill, South Carolina. And I came to South Carolina in 2002. We were one of the 19th practices that are independent. Today we are the only truly independent practice left in the state. And it's all because of the merger and acquisition. And what happens is, once the acquisition happens, the out-of-pocket cost goes up to 5 times, sometimes up to 10 times. This bill allows us to now open up our center for getting a PET scanner, a radiation center that could be a one-stop shop. And what I want to add is that we are the first state in last 22 years. First out of 22 states in 50 years that could repeal that. So hats off to all the lawmakers, including Senator Clymer, Senator Verdin, Senator Harvey Pillar, and Governor, as well as my colleagues from South Carolina Medical Association, to take this heads on to make access better for poor South Carolinians. Thank you very much.